Most people believe Medicare A is free, and technically it is. But here's the uncomfortable truth no one explains clearly. Free doesn't mean you won't owe thousands. In fact, this is exactly where some retirees experience financial shock, not because Medicare failed, but because one small structural detail was never fully understood. And it usually happens during a hospital stay. Not when you're relaxed, not when you're reviewing paperwork, but when you're vulnerable. So today, we're going to slow this down and look at what Part A truly covers, what is genuinely free, and where the real cost exposure quietly lives. Because once you see this clearly, you'll understand why hospital coverage can feel safe at first and expensive later. First, let's reset what Part A actually is. Part A is hospital insurance. It covers inpatient hospital stays, skilled nursing facility care after a qualifying hospital stay, hospice care, and limited home health services. Notice the word inpatient. If you're not formally admitted to a hospital, Part A usually isn't paying. It doesn't cover routine doctor visits. It doesn't cover outpatient procedures. It doesn't cover most prescriptions. That's other parts of Medicare. Part A is about hospital-level events. Now, here's where the misunderstanding begins. Most people don't pay a monthly premium for Part A if they or their spouse worked and paid Medicare taxes for about 10 years. So yes, the monthly premium is often $0, and that's the part people remember. But the premium is not the real story. The real story begins the moment you're admitted to a hospital. Because Medicare Part A doesn't have a yearly deductible. It has a deductible per benefit period. That sounds small. It isn't. Each time you're admitted to the hospital, you must first pay a deductible that can run into the thousands before Medicare starts covering most of the stay. And here's the part that surprises people. If you recover, go home, and more than 60 days later you're admitted again, that deductible resets. You could owe it again. Not next year, not once annually, per benefit period. This is where people say, wait, I thought I already paid that. But Medicare doesn't think in calendar years for Part A hospital stays. It thinks in benefit periods. And that distinction alone explains why two hospital visits in the same year can feel financially very different. Now let's talk about length of stay. After you pay the deductible, Medicare covers most hospital costs for days 1 through 60. But after day 60, daily coinsurance begins. After day 90, you start using something called lifetime reserve days. You only get 60 of those for your entire lifetime, and once they're used, you're responsible for the full cost of additional hospital days. Is that common? No. Is it possible? Absolutely. And most people never even know lifetime reserve days exist until someone mentions them during discharge planning. Now let's move to something even more misunderstood: skilled nursing facility care. Many retirees assume Medicare covers long-term nursing home care. It does not. And this is where expectations and reality separate quickly. Imagine someone recovering from a serious fall or stroke. They spend a few days in the hospital. They qualify. They're transferred to a skilled nursing facility for rehab. Days 1 through 20 covered. Day 21, a daily coinsurance begins. After day 100, coverage stops completely. But here's the emotional reality. Recovery doesn't stop on day 100. Care doesn't magically end because the calendar did. And this is when families discover something most never planned for. Medicare is health insurance. It is not long-term care insurance. Long-term custodial care, help with bathing, dressing, eating, is generally not covered by Part A. And that realization often comes during an already stressful moment. Now, to be fair, there is one area where Part A is quite generous: hospice care. If a doctor certifies a terminal illness, Medicare covers most hospice services with minimal out-of-pocket cost. pain management, symptom control, support for the family. Hospice is usually not where financial shock occurs. Hospital deductibles and extended skilled nursing stays are. That's where the surprises tend to live. So, let's bring this together clearly. What's free under Part A? For most people, the monthly premium, the first 20 days of skilled nursing, if you qualify, most hospice services. What's not free? The hospital deductible per benefit period, daily coinsurance after certain hospital day limits, skilled nursing after day 20, long-term custodial nursing home care. And here's the key takeaway. These are the areas that tend to surprise people during already vulnerable health moments, not because Medicare is broken, but because the structure wasn't fully understood ahead of time. Part A is powerful protection against catastrophic hospital bills, but it does not eliminate financial exposure. And understanding that difference before you ever need hospital care is what prevents that quiet moment of, "Why didn't anyone explain this clearly?" In the next episode, we're going to move to Medicare Part B, the part almost everyone pays for monthly. Because if Part A surprises people during hospital stays, Part B is where the slow, steady cost increases happen year after year. And that's a conversation every retiree needs to understand before those increases quietly add up.